How is COVID-19 specifically impacting the Black and Brown community? Why is COVID-19 impacting the Black and Brown community more than others? What should the Black and Brown community do to improve their survival odds? How to protect yourself while advocating for social justice during the pandemic. Dr. Tori Gartmond answers questions, shares tips, and debunks myths for the Black and Brown community during COVID-19. My name is Shakayla Johnson. I am a member of the Watts Community Wellness Committee. And I have with me Adrian Acosta, who is also a member of the Watts Wellness Advisory Committee. This channel was crafted out of bringing wellness to the community of Watts during this situation that we're now in with COVID-19. We just wanted to bring some resources and some information to everyone, specifically to our community, so that everybody is informed. And we have a special guest today, Dr. Tori Gartmond.
Hello.
Hello. And could you please let us know which hospital you work for, Dr.
Oh, yes. I am a internal medicine resident at the University of Illinois at Chicago.
And our guest today is going to give us some good information and tips on how to be better at protecting ourselves during this pandemic as Black and Brown people, and how to just overall be more informed about COVID-19.
Good. Well, I just first want to thank y'all for having me. I am very happy to be a part of y'all's channel and hopefully give y'all some good information that the community can benefit from. These are trying times that unfortunately don't look like they're going to be resolving anytime soon. So hopefully, we can have a pretty good discussion today and give some good information to help out the community of Watts.
Thank you so much for being here. And it's very much, like you mentioned, it doesn't seem like this will be something that will be ending soon, unfortunately. But very much, we really want to get the most accurate information out to the community, and we want to make sure everyone is safe. This is something that is very serious. If you pay attention to media, you'll hear so many different things and so much different types of information. And what we really want to do here at the Watts Wellness channel is provide you with the accurate information so that you can best take care of yourself and your family. Help us understand a little bit more of how COVID-19 has impacted communities of color.
Yeah, absolutely. So unfortunately, like many natural disasters that occur in the United States, Black and Brown communities are disproportionately affected. In the United States, since COVID has emerged in late December, really early January, about 30% of COVID cases in the U.S. have affected Black people, who only make up roughly 13% of the population, and that's pretty significant. Same thing for Latinx communities. Roughly 19% of the Latinx community makes up positive COVID-19 cases. 19% of the population, roughly 34% of COVID cases. Mm-hmm. So as you can see, those numbers are pretty astounding. And, it continues in various cities, across the country, from, New York City, which was the large epicenter, from here in Chicago to St. Louis to New Orleans to Houston, and even, where you guys are out in California. And so it's, very disappointing to see that, but there are various reasons that we can discuss today as to why, public health emergencies or any sort of natural disasters tends to present itself that way in our communities.
So why do you think that is, that people of color are being disproportionately affected by COVID-19?
Sure. I think there's a lot of reasons, particularly with what happened, particularly for this disaster, first being a poor response from our national leadership. I think just in general, not having the appropriate personnel to carry out a coordinated response. And so things are every state for themselves, essentially, at this current point in time. But even, I would say, the first, misstep was the level of misinformation that was spread at the very beginning. And on average, unfortunately, lower socioeconomic and minority neighborhoods are usually the ones that are to get information last anyway. So that if you have information that isn't correct, and then you also get the correct information later, you're more likely to be disproportionately affected, by said illness or said disaster or whatever the case might be, right? I think the first one was Black people can't catch COVID, right? Because there were low rates on the continent of Africa. And so as a result, people probably just thought that they were not going to be impacted, so a lot of the information didn't apply to them. But as we can see, that's definitely not true based on the numbers. Again, seen in largely communities of color living in densely populated areas. So whether it's, government housing, taking public transit, more likely to be essential workers, all of these things increase your exposure in general. Constantly being in contact with other people, even from, thinking of essential workers who may have children, right? If they have to have family members watch their kids, again, that's more exposure, having a neighbor, having a family member, having someone help them out so that they can continue to work to provide for their family. And then also considering people who may have restricted incomes, doesn't allow them the freedom and the liberty to stock up on food and have food for a week or 2 weeks in their freezer or refrigerator. As a result of not being able to do that, you're at the grocery store more frequently to have to go back and replenish so that you can feed your family. And then, of course, the underlying reason for all of these things, which I don't want to be left unsaid, is systemic racism. So, from redlining to government housing to even the response during COVID of the distribution of testing centers, weren't even distributed in areas that we knew likely needed it more than others. It normally went to more affluent, more wider neighborhoods over those that we know on average need more resources, right? So, all these things combined make Black and Brown communities more susceptible. For even clinics that largely take care of these patient populations, they also had to close down, during this time. So testing might not have even been available as the one testing center that they might have had in their community. So it's just unfortunately, it's a perfect storm to allow for these inequities to perpetuate themselves, whether it's, health outcomes, whether it's housing, whether it's food insecurity. A lot of these things overlap, which is the underlying foundation of that is systemic racism. So.
And one thing you mentioned, and another thing, just as far as, like you mentioned, just the basic necessities of going to the supermarket and increasing in frequency. But one thing I've noticed, I live in the Lenox Inglewood area. So I'm relatively close to the South Beach areas and stuff like that, and Watts as well. And just the differences of how many people have per supermarket you virtually have within these different communities. Mm-hmm. So, one supermarket is going to automatically be more full because you just have more people in that community only having that one option. The other communities having multiple options and being able to really social distance.
Absolutely.
I did have you mentioned redlining, and I don't know what that is. Could you explain what that is?
I am not 100% well-versed with redlining, but and I don't want to misspeak, but to my understanding, it has to do with unfair housing lending I guess, for like mortgages and things of the sort, which basically allows for increased segregation based on racial demographics in neighborhoods. So you're more likely to, have Black people populated in one area of the city and then white people populated in another part of the city. And so as a result, it allows Black people to be targeted in terms of environmental racism, food deserts, all sorts of things. That's my basic level of understanding of redlining. I'm not super well versed, but it just, again, it allows for the different distribution of resources a little bit easier to affect people based on demographic.
Yeah. Yeah, that was a great explanation of it. That's pretty much what redlining is, like food deserts, disproportionately being denied access to mortgage and just overall resources that other folks have. How has LA, more specifically Watts, been impacted compared to other communities of color by COVID-19?
Sure. So most of the information I kind of found was more so on Los Angeles. I know Watts is a very specific community, and I could only find like one specific resource that commented about it. But basically, from what I found about Los Angeles is roughly from kind of like this second sort of big peak that you guys have had as of lately, roughly pretty much over 50% of these new cases are in people that are 40 years old and younger. So, they're hitting like our demographic a lot more as opposed to beforehand, there were older individuals, people that were in long-term care facilities, et cetera. And LA County in general accounts for roughly 40% of all the cases in California. So that's a very large number of cases that is in a small, area of California. So it's that's quite a bit. I think there's about 150,000, over 150,000 cases just in LA County alone. Specifically in Watts, from what I found, was about 1,000 cases, a little bit over 1,000 cases, and the population of Watts is roughly 42,000. But basically the case rate would be roughly like 2,200 people per 100,000 people. So if you think about that, Watts doesn't even have 100,000 people.
Yeah.
You're already essentially at like half of that for the rate. Close to 100,000 people. So, that's something to be concerned about as well. Because again, to my understanding, Watts is also, a very low resourced area of California, people densely populated, largely Black and Latinx communities. And I can imagine their health facilities are either safety net hospitals or federally qualified healthcare centers that also provide care, that also probably are under-resourced and understaffed and might not even be able to handle a lot of what might be going on. So.
Well, thank you. Thanks for explaining.
Right, and even like you mentioned, as far as just resources, food desert is a constant conversation that is had in Watts as far as just access to quality food and healthy food, and how that's always been a challenge to ultimately have in Watts.
Yeah, they took away our only food. What was it? We had a farmer's market at Tim Watkins Park. And I used to go there, and it's been gone for it was the only farmer's market we had here in Watts. And I'm like, why? Why?
I mean, when you think about that, right? Someone goes to the doctor and, they may be overweight or they may have some chronic medical condition like high blood pressure or diabetes, which we know are, associated with worsening health outcomes, for patients with COVID. And you tell them, oh yeah, please, eat better, right? Like I tell my patients all the time, what are you eating? Oh, this, that, and the third. And then you don't consider that their only farmer's market was taken away from them where they can get fresh produce. So it takes them, 20 minutes to take a bus downtown or drive downtown or whatever means to get food, as opposed to just going to a local bodega or, something that doesn't have as fresh produce. And it's just an unfortunate cycle that continues to repeat itself. And it is very frustrating. And, I hope now we definitely have the attention of those in power who can make a difference. Because, we deserve a fighting chance just like everybody else,
And I'm glad you mentioned that, because just a lot of things that even in a focus for our channel is wellness and considering, just mental health and everything. And just the example you gave of virtually needing to decide between going on a bus for healthier food
right,
and risking getting on a bus for
right,
healthier food.
right.
Like, you're constantly ultimately making sacrifices in one end for another in regards to health.
Yeah, that's a good point too. And, it's not like people have the option to order Hello Fresh. Yeah, it's exactly. So it increases their risk in general. It increases, their exposure, time spending on an enclosed space, going to another environment that may have, another zip code that may be worse as far as the outbreak is concerned. Yeah, it's just a lose-lose situation.
Is there anything, and I know one of the main things that has been advocated is wearing a mask, and also wearing a mask properly is something that has also been discussed more. Is there any other steps, and this is something we also talk about and exactly kind of cuts into what we just mentioned, why it is important for people who do have the privilege to stay home or not go out as much for us to do so. And, speaking for myself, in which I can kind of stay home and I have to also stay home for my parents' sake, staying home for the sake of the fact that other people do not have that luxury. And like you mentioned, we have a lot of essential workers. We just give it an example of people needing to go out more just to feed themselves, for the groceries, different things like that. Is there in that light, is there anything else that we can do to really increase our safety?
Yeah. I mean, the mask wearing is probably the most important right now. As you know, COVID is spread via, respiratory droplets from your nose, mouth, just from talking, sneezing, whatever the case might be. So wearing the mask over your nose and mouth, whoever it is that you are with that does not live in your immediate household should also be wearing their mask over their nose and mouth, appropriately physically distancing from people. So I think I even read an article, though, luckily, that grocery stores are actually low risk for catching coronavirus, which at least is positive. But, you never know. Either way, it's always good to just be safe. Washing hands frequently if there's hand sanitizer or soap and water, is the best thing. I'm personally a little bit, I don't particularly favor wearing gloves because when you wear gloves and you touch everything, so the gloves are dirty and you're kind of touching everything around you in general. And so it just continues to spread whatever is like on your hands versus just washing your hands, which is always going to be the best policy as opposed to just wearing gloves in general. As far as, if you do feel sick, staying home, obviously staying away from your loved ones at home, and not going out if you can avoid it, and calling your doctor, for next steps as far as what it is that you should do. But hopefully, that doesn't happen with the preventive measures that I just mentioned previously.
Thank you for breaking that down about gloves, 'cause that was something me and my family were doing. At first, my mom
Yeah.
was like, "Hey, do you have your gloves? Make sure you
Yeah.
put your gloves on before you get out your car and go to the grocery store." And I'm like, I don't know. This makes it a little bit more complicated in a
Yeah.
sense because you're worried about, okay, I'm touching stuff with my gloves. Now, if I keep them on, that's it. So, yeah.
Yeah, you're just better off washing your hands and wiping down your surfaces. So if you think about it, right, if you wear your gloves in the car, right, and you get in the car and you touch your steering wheel with your gloves on, but then the next time you don't have your gloves on and then you touch your steering wheel, right, your steering wheel may still be contaminated with whatever was on your gloves.
Yeah.
So it's just, in my mind, it's just better. You know what? I'm just going to wash my hands a little bit more frequently. I'm going to wipe down my surfaces a little bit more frequently. Hopefully, as things, cleansers and stuff start to become more available. I just feel like that's just a little bit easier as opposed to like going through a whole bunch of gloves. And, supermarkets and things are doing a pretty decent job of, cleaning baskets and shopping carts and things like that to also help reduce the spread. But another thing too is with your bare hands, also trying not to touch your face. So, not touching your eyes, before you eat or whatever that, try not to put your fingers in your mouth or in your nose and stuff like that as well. I know everyone has their own thing. You can wear gloves if it really makes you feel better. But I personally, whenever I see people, I'm like, all the things that they've touched, it gives you like a false sense of security, almost as if you won't catch anything, but honestly,
The false sense of security is exactly what I was thinking of and how
yeah.
I've ultimately thought about it. Is I'm far more conscious to wash my hands for not having gloves versus thinking I'm safe with gloves and just spreading that
Right.
everywhere.
Exactly. Just getting a little thing of hand sanitizer and just being cognizant,
Yeah.
And it doesn't hurt just to keep washing your hands.
Yeah, I'm not mad at them wiping down baskets now and all of these new cleaning measures. I'm
I
not
know.
mad at it at all.
Well, it
Ironically.
makes me wonder what people were doing beforehand. I think that's like the scary part about it was when I first went to the grocery store and everything was sold out in the cleaning aisle. I'm like, I at least at baseline have bleach under my, like cabinets with wipes and some, Pine Sol and whatever. So it made me curious what people were cleaning with beforehand. But I'm glad and I hope that people continue to adopt these, cleaning habits throughout COVID. So.
I feel like those baskets weren't getting touched as much as they needed to. Now they're all of them around the nation.
Right.
I've always had a thing about grocery baskets. I'm like, oh my God, these things are nasty. So I'm happy about that. Well, that's like a little sliver of a silver lining situation.
Absolutely.
How long do you think that we need to be safe at home? Like, how long do you predict this will?
I honestly cannot predict it. I think, we should be preparing for fall and winter. Our hospital system is already preparing for fall and winter, anticipating when the rest of, the seasonal viruses come back from the flu virus, the common cold, along with coronavirus, that again, hospital systems will be overwhelmed. Unfortunately, we did not have a coordinated response from the beginning. And we might be, if we did, we might be nearing the end at this point in time. But because we are so fragmented in our approach, I do not foresee it ending anytime soon or us returning into some sense of normalcy. I think I'm reading about the flu that happened in 1918. I think that lasted like 2 years.
I think I heard 3 coming up.
Yeah, 2 or 3 years. So, just to keep that in mind, right? There are other countries, right, that stayed in the house, did what they were supposed to do. We're under stay-at-home orders, quarantine for 6 to 8 months, and now they have 0 cases, or their cases are negligible, and they're out and about, starting to live their lives. So unfortunately, we didn't do that. So
No.
And I'm glad you pointed that out as far as why we can't compare our next actions as a country to other countries, because we didn't take their actions to be prepared and actually deal with this in the first place. We can't take their actions to follow up.
Right. I wish it was true. I wish, that we were on par. I really, really do. But on top of us, not having anything under control, now we're also stuck here until things get under control, because we can't go anywhere. Nobody's taking us out of the country. Our passports are duds currently.
I think I just read that the Bahamas or the Caribbean somewhere has just banned Americans from visiting their islands. They're like, y'all not bringing that over here.
Exactly.
I think there are very few countries at this point, like within a handful, that are allowing U.S. citizens into their country at this point.
Right.
Yeah.
So if you plan on traveling anywhere, anybody, be sure to check beforehand, because you'll be stuck at customs and immigration.
Yeah.
How does the symptoms in the Black and Brown community vary from other communities? Because I heard something about Black people we don't really get temperatures, and that's another way we go without getting treatment until it's too late, or fever.
No. No, I wouldn't say that. Everyone can mount, a response. It's just that in general, COVID symptoms vary from person to person. So, you can be asymptomatic and be a carrier and test positive. You can just be fatigued with a mild cough and just not feel like yourself and not have fever and test positive for COVID. You can have severe symptoms where you're febrile all day for multiple days in a row, coughing, short of breath, can't breathe, chest pains, low oxygen in your blood, and test positive for COVID. So I don't think there is any one script per se. We call it like an illness script of how anyone presents. Some people may just have lost their sense of smell or lost their sense of taste, right? And test positive for COVID. So I think it's very be very cautious when you hear about things being isolated to just one demographic of people, because it's likely not true.
Okay.
Can you explain a little bit more, just because I don't believe the general public really understands what asymptomatic means.
Oh, sure.
How that is still one of the biggest issues, it seems like, as far as spreading the virus is.
Yeah, absolutely. So being asymptomatic or an asymptomatic carrier means that you don't have any symptoms. So you are functioning at your baseline, you feel great, you feel like your regular self when you get up every day, but you still have virus that's in your body that has the potential to be passed to the next person. And so that's why it is important for people to wear masks, even if you do feel well, to socially distance or physically distance yourself from others, because just because you're not having any symptoms does not mean that if you pass, the virus along to someone else, that they will also just carry the virus and not show any symptoms. You may very well get that person sick. I think we want to avoid that, until we're able to get a treatment or a vaccine, because that's really where our, immunity will hopefully come from.
And I feel like that's something I've heard a lot of people, as for people who have downplayed the virus and then all of a sudden change their mind, is someone was asymptomatic and did not feel that they would get other people sick,
right?
And wind up getting a lot of loved ones sick. And that's really the hard part, is you may hurt the people you love the most,
right?
By not taking care of yourself.
Absolutely.
Yes. So I also, maybe you can debunk a couple of myths that I've been seeing on the internet, that's been freaking me out a little bit. So I also saw that people experience their blood clotting, and that's ultimately why they succumb, is because they're not getting enough oxygen, and that's why the blood is clotting. So
Mm-hmm.
is there something we can do to, like, I don't know, I don't want to say thin our blood during this
Yeah.
time, but to keep from blood clots, like any like holistic, like, well, drink some tea or the warm liquid.
So coronavirus, to my understanding, when you are infected, and I think it just varies from person to person, like I said, just depending on your symptoms. But normally in patients that have very severe infections do develop what we call a coagulopathy. So that means your blood has factors that help blood clots, and factors that help break down clots in the blood. There's two kind of different mechanisms of this, like, pathway, for instance. And so when you do have coronavirus, this kind of balance goes out of whack a little bit. And as a result, your blood has a tendency to clot a little bit more, and particularly in very small, like, blood vessels. So people will get them in their lungs. Sometimes they'll get them in their distal feet. I've seen, I think, people who come in with, like, strokes and things of the sort. But unfortunately, there isn't anything that will protect you against that, unless usually some hospitals, particularly at our hospital, for patients that did meet a specific criteria, we did put them on a blood thinner to prevent that from happening. But that is not a routine treatment, like if you were stable enough to be at home, that anyone would prescribe you.
Okay.
So, if you do have coronavirus, things to look out for, would be swelling in your legs, for instance, particularly one over the other could potentially be indicative of a blood clot that may be developed in your legs. If you do go to the doctor and, you're feeling extremely short of breath, or you're having chest pains or something of the sort, it would be worthwhile for those doctors to check and see if you developed a blood clot in your lungs. If you are having chest pains, also looking to make sure that your heart is functioning okay and that you're not developing, any signs of injury to your heart that would suggest a heart attack. And again, looking for a stroke, if you have facial droop or slurred speech or any sort of weakness on one side versus the other would be other indications to also go to a hospital and be evaluated.
Oh, wow. Thank you.
Mm-hmm.
Any other weird like symptoms like that people would not have normally think about, other than the normal ones that people see?
I mean, like I said, I've seen stories or cases that people write about where patients just develop what we call end organ damage. So all of their organs just end up shutting down. And again, those are in very severe cases. And we think it's likely related just to the inflammatory response from, the coronavirus, or did they develop a blood clot that then, led to, the parts of their body not getting enough oxygen, or whatever the case might be. But like I said, those are very, very severe cases, from what I've seen. But the scary thing is that you don't know which way you're gonna go, right? You could have a very mild disease where it's just the sniffles and a cough, or you can end up in the hospital and be on oxygen for the rest of your life. And so that's why, it's important to take these things seriously, or even to the extreme as you lose your life, right?
Right. Okay. Well, I'm sorry, Adrian. I have to ask one more question. I've seen nurses say that they'll be in a room with patients, or they'll be with the patient and they'll go back and that patient will be gone. Like, how does that happen? That someone is talking and then they're all of a sudden, I mean, when they're in the hospital, I guess they have the severe symptoms by that point, but then they go from talking in the hospital to then being like really sick and dead.
Yeah.
Have you
I
seen that?
mean, so these patients in general, like I said, are very sick. When you're not getting enough oxygen into your body honestly can't really sustain itself. So, this is primarily a lung disease. The coronavirus largely affects your lungs and your, upper airways and things like that. So when, you develop this pneumonia, it impairs your body's ability to get enough oxygen into your blood. And your body needs that in order to survive. So if you don't have enough, your heart will stop. The rest of your organs will become damaged. Your mentation might change, so you might become confused because your brain isn't getting enough oxygen.
Oh, wow.
And so all these things happen, and it builds up over time. And so your body's under a lot of stress to try to fight this infection. And your immune system is working overtime, which also contributes to people getting very sick as well. And so, it's just unfortunate that these patients are very unstable. Some of them do recover, but other ones, they progress. And, when the nurse does go out of the room to check on another patient, unfortunately, that may be the time that patient decompensates or ends up, losing their life.
Yeah. Thank you.
Mm-hmm.
When and this is where a lot of kind of goes along with our channel. One of the things that it kind of sounds like really we should be focusing as well as preventing, the spread and COVID, is also taking care of ourselves as best as we can, as far as just general health practices of, eating healthier, drinking water, trying to, even though we should not be outside, getting as much exercise as possible and movement and general health practices so that our immune system is best able to deal with the virus if we are unfortunate enough to get it. Is that kind of also what I'm hearing?
Absolutely. I mean, I know it's different being in the land of COVID where people aren't going to work, people aren't seeing friends, people can't go to the gym, but trying to maintain some sort of normalcy or routine or schedule is also very good for your health. So, going to bed and waking up at the same time every single day, and getting an average of 7 to 9 hours of sleep every single night works wonders for your immune system.
Sure
Sleep
does.
deprivation is one of the worst things that you can actually do. And even actually, one of my favorite studies actually looks at patients who get like the flu vaccine and those who actually get the recommended hours of sleep versus not. Those patients who get the recommended hours have a better immune response to the flu vaccine than those who don't, right? So, sleep works wonder. So, not, even though you don't have anywhere to go first thing in the morning, not staying up till 2 a.m. To wake up again at 8 a.m. to then get ready for work, but really maintaining some sort of normal sleep schedule to where you're getting the recommended hours. There's plenty of at-home exercises. I know it's not the same, but I know I bought myself a jump rope and I have my yoga mat and I have some at-home weights and kettlebells, and trying to stay on top of those sorts of things. And if you can safely go for a walk outside in your neighborhood or if there's a park close by, again, just being cognizant, wearing your mask and really staying away from people who are not in your immediate household. And then, like you mentioned, just trying to eat a healthy diet. It's easy now to get everything delivered to your house, right? Those people are working overtime. But again, that's more exposure from handoffs from people. And then probably also not the most healthy, food options. So trying to eat at home. And honestly, that'll go a lot, towards wellness too, if you don't live by yourself. If you do have a family, and sitting down and eating with, your kids, your spouse, and just talking with them, getting to know them a little bit better, as opposed to being two ships passing, in the night. If you guys spend all day at work, actually having some quality time together, even though we might be around the time where people might be getting tired of everybody since we've been in the house for a while. But it does go a long way because we are social creatures, right? So I know I've done some Zoom conversations with some of my close friends, doing video chatting, since that's one of the great things that we can do, just to stay connected. So I think all of these things go a long way. And many people have even found time too during coronavirus, with the stress of this, in conjunction with a lot of the demonstrations that are going on around the country, to find a therapist and to start going to counseling or starting meditation or other things, to really help them cope with this life change. Even looking into it for people's children. This is a big change for them too. They want to go to school. They want to see their friends. They want to go outside and ride bikes or go to the neighborhood pool. And so, children, if they're acting out, this may very well be the cause of that. And so seeking help for them as well, and helping them cope would go a long way. So definitely looking into things like that to really help us, get through this, and hopefully we can get through it together.
And I just want to point out, jump rope is no joke.
Oh, yeah.
Anybody that wants to say that jump rope is an exercise, I challenge you to jump rope daily.
Absolutely.
That is very good core exercise.
Yes, it is. Actually, Dr. Tori and Adrian, I have a trampoline that I bought last year,
Oh,
a
wow.
mini that I got off Amazon for $45, and it's the equivalent of jumping rope times 10. So you get the same benefits, more, but your knees and stuff is protected because you don't have that, you actually get help when you land. So
yeah.
I use my trampoline and I stimulate my lymphatic system. That's why I use it, because I'm trying to get that waste out, trying to get all that stuff moving, so I don't accumulate any of that nasty stuff. So that was some of the stuff that we shared on the channel. That was some of the first things that we shared on the channel, is wellness tips about exercising at home, because we know you can't go to the gym like that anymore.
I know.
How to de-stress and stimulate your immune system and stuff.
It's so easy just to go sit down or to go lay down. But really being disciplined, and that's why I mentioned, having some sort of routine throughout the day will really make it that much easier, to stick to any goals that you have laid out, or stick to exercising, or whatever the case may be. So.
And we've discussed it on our channel, but as you mentioned, yoga being very good exercise as well. Again, that's another exercise I feel that gets undersold as far as being really great exercise. But as you advance through yoga, that's something that as someone who has played sports most of his life, when I got exposed to yoga, I was very humbled.
Yeah.
So along with that, and one of the things I do want to make sure to mention that we've been doing on our channel, so I want to make sure people keep up, is we recently started doing community resiliency model trainings for the community. And a lot of that is the idea of us just being able to stay in our best mental space through this time, and understanding that this is not easy time in any scope, whether you're looking at social justice, whether you're looking at health, whether, just the state of the nation. This is not easy times for everyone, and just the importance of really maintaining that overall wellness within you, whether that be, exercising your body and getting that movement, or taking that time for your mind to really calm down and for your emotions to be in the best state as possible.
Yeah, absolutely.
So as far as the impact in your city, how would you compare that to here in LA versus Chicago? Do you see similar narratives and situations going on?
Yeah, so in Chicago, we do have pretty bad disease in our, Black and Latinx communities, specifically, and it was very apparent very early on. I think it reached the news, I think, just a couple of weeks after we had shut down. And so in Chicago, about 30% of the population in Chicago is considered Black, and they make up roughly like 30% of COVID infections, but are overrepresented when it comes to deaths related to COVID at roughly 43%. And so that was a very stark, statistic, and really urging our elected officials to pay attention to that. And then from what I have here from LA is, Black patients make up like 8.2% of the population, and 10.5% of COVID deaths. So again, a similar sort of demographic or effect from COVID particularly. And then same with like Latinx community. So here in Chicago, our Latinx population is roughly 28%. And then they're making up roughly 47% of just active infections, and then 32% of deaths, total deaths here. And in LA, you'll see 43% of the population is roughly Latinx, and then 30% of infections, and then 46% of COVID deaths. So again, you're seeing, that they're making up a large proportion, of infections and deaths, particularly compared to, not just their demographic in that city, but the demographic from the United States as a whole. Right. So, that's what's extremely concerning. And I actually read an interesting article the other day that also in LA County, I think the Asian Pacific Islanders group has also been disproportionately affected by COVID, which I thought was very interesting as well. And so there's largely, from what I was reading, probably has to do, with similar issues. But one of their things was still having like large family gatherings, which is like a part of a lot of their traditions. So just being cognizant of, like cultural differences that might put, more people at risk versus others as well. So.
One of the last things I definitely wanted to ask is there a general timeline of how long the virus? Because I know if some people who have symptoms can go forever, but how about someone who may be asymptomatic? Is there a general timeline as to?
So it's unclear as far as people who like have the virus and who don't show symptoms. They just have to keep getting tested. Generally, if you've had some sort of exposure, you normally wait about 14 days to see if you develop any symptoms. And if you do, then it's recommended that you get tested. But usually the incubation period, which means the amount of time that it takes the virus to reach a certain level in your body to show symptoms, and basically like you're kind of contagious, is between 2 and like 14 days, which is why our incubate or our like quarantine period is that long. But if you do get sick, it can be roughly like 2 weeks for people to really feel better. And if you really have severe symptoms, it could be 3 or more weeks. Again, it varies depending on the person. Do you have any sort of underlying illnesses, et cetera, et cetera. So.
And I know I've read stories of completely healthy people that are still experiencing the symptoms, and they got it from the very beginning, and it's just affected their respiratory system, and that doesn't seem like it's now going to change at all for the rest of their life.
Yeah. And that's what's scary about it, is this virus, like I said, it's new, to the human species. It's not something that our bodies have any sort of defense against. So when our bodies, mount an immune response and tries to fight off this virus, it also damages the body as a result of trying to protect it. And so some people recover from that. Other people might have long-lasting sort of effects, whether it's they feel short of breath regularly, or don't feel like their exercise capacity is as good as it was before, or whatever the case might be. So that's why I say just be cautious, because you never know which part of the spectrum you're going to be on.
People can lose their sense of was it smell and taste permanently?
I think those resolve. I think you eventually get your taste and smell back. Those are more on the mild side of symptoms.
Does symptoms vary between age groups? So do elderly people experience certain types of symptoms more than a certain group, or even children?
Yeah. So it's been interesting. Some of the things that they're saying about kids, that they're not as badly affected. However, there are some that are, that develop a really bad inflammatory condition or syndrome. But I wouldn't put it past anyone, to be honest with you, and how people present, with coronavirus. I think it can, just like symptoms can vary from person to person, I think it can also vary depending on the age group as well. About ways to be like politically active, like during this time, how to protect yourself while you are being politically active. And so, during this time, like I said, there are plenty of demonstrations that are going on around the country, and a lot of researchers have said that during those times, if you're practicing appropriate safety measures, like wearing your masks, having hand sanitizer, kind of staying away from people, that actually did not affect the rise in cases that you see. And so, as long as you're doing those things, if you do want to go out and demonstrate and demand, justice for all the injustice that we have in this country, I highly recommend it. I went out here in Chicago. I had a much larger kind of like respirator on, but many people wore masks. There were people that were out there distributing masks. We were outdoors. People were handing out hand sanitizer. So it was a very good experience. And like I said, our cases didn't explode, like soon after those demonstrations, and people are still out there demonstrating, from what I even saw this past weekend. And other ways that I want people to be aware moving forward is paying attention to our elected officials that are actually doing things with us in mind. So that means, our local government officials, our state government officials, how are they responding to Black and brown people being disproportionately affected? How are hospitals responding? Are they becoming more engaged with our communities? It's super important to pay attention, because during this is an election year, and so I don't know when California will be electing their local or state officials, but for people that don't have us in mind, if there is someone who is, it's important to get out there and vote. This is also a census year where we are filling out our censuses. Please send in your censuses, because again, that lets us know where people live, where people reside, so that they can distribute the appropriate resources that we need to survive, and survive equitably, as compared to other areas that do get better resources. And then probably like the last plug I have also for being politically active, or just being involved as far as combating coronavirus, is if you do get tested and you do test positive, when you start feeling better, if you're asymptomatic, whatever it is, going back and getting tested to see if you have built antibodies to the virus, because there are many studies that are going on right now to try to find a way to beat this disease. And if you have antibodies, which means your body now recognizes coronavirus, if you were to get infected again, your body knows what to do next time. And you're actually able to donate your blood, or technically your plasma, and give your antibodies to somebody else to help them beat coronavirus. And that is another way, that we can protect and help our communities. If we can do this at our local hospitals, hopefully, the hospitals that take care of us, and will help Black and brown people. Same thing with vaccines, trials that are currently going on. Historically, I know that there's mistrust with the Black community and Latinx community when it comes to clinical trials, because we have been experimented on in the past. I totally get it. But at the same time, we want these studies to be applicable to our communities. So if there is something, that is going on, some sort of study, some sort of trial, please just get information about it and see if that's something that you want to be involved in. I'm participating on our coronavirus vaccine trial here in Chicago. And, I'm trying to work with our community activists to see how we can best bridge, the trust with our community so that my Black and brown patients will be represented. And we can say, hey, we know that this will work on everyone, that because we have representation of everyone. And unfortunately, staying out of these studies and not participating doesn't do a great job of allowing us to say, hey, this represents the United States population, or this represents our population here in Chicago. And we know that if we give this to everyone, that this will work. And so I want to encourage everyone that, we also have a responsibility to help our medical community, better take care of our communities as well.
Thank you for all of that, because yes, all of that is very relevant and very much kind of also the social justice piece. I know I went out once and, used my mask, and I know Watts recently had a blood drive. That was very, done very safely. And that's where I also learned about that they're testing for the antibodies. I also learned I'm O negative, so I should be giving blood a lot more now. So I did also, but yes, no, thank you really for mentioning all of that, because that's very important. And social justice is a huge component of Watts, and it's always been kind of an epicenter for
absolutely.
that. So it's definitely something we've had a lot of communication on. So I really, really appreciate it. And the vaccine information and all that. I never thought about it in that light, as far as representation and the necessity to have all that diversity in that representation.
Exactly.
So that we do understand. I had never thought about that.
Yeah, we're a melting pot here, in the United States. We have so many demographics of people. And, when you don't have, just the representation, it's hard to just generalize it. And it's not meant to say that it will or won't work in Black or Latinx patients. It's more so to say this population that we have, trialed this virus, or not this virus on, this vaccine on, is representative of the patients that we want to treat. And so, we just want to make sure that we can apply it to everyone. And so, I really hope that people consider it. I know that there are hurdles ahead of convincing people, to be a part of it. But hopefully, with what we discuss here today, that I've convinced a couple people to go and consider enrolling or donating blood, like you mentioned, or donating their plasma if they are positive for antibodies, or whatever the case might be.
Yes, thank you so much, Dr. Tori, for speaking that to us, because we needed that information, especially about the social justice, still advocating for your rights and for your civil rights while still protecting yourself during this pandemic. So thank you so much for touching on all of that. It's been wonderful speaking with you and interviewing you. So that.
Well, I was more than happy. I've been looking forward to this all day, to be here with y'all and, answer y'all's questions. And, I think it's really great what you guys are doing. I really love that you all have this for your community. I think it speaks a lot to how much you care about your community. And I really wish that more people would do, or have, I should say, platforms like this where, it's just easily accessible, it's easy information, and relevant information.
And it's by the people in the community.
Exactly.
That actually lives there.
Right, exactly. It's not what we call helicopter research, which is just people who swoop in and get what they want and then kind of leave and come out. But you all live and experience what people are going through, in the community that you guys are trying to impact. So thank you all for having me. This is awesome. And what y'all are doing is very admirable.
So we want to thank you. Thank you again, Dr. Tori, Shakayla, everybody for your time. We really appreciate you. You've made it this far throughout the entire video. We hope you learned a lot of information. I know I have. personally, a lot more than I actually anticipated, knowing, given that I even did research for this interview.
I learned so much. Sorry.
Yeah, I definitely learned a lot. We hope you all did too. And we hope this really echoes the message that we've really been trying to communicate through the channel of the importance of taking care of yourself, not only for yourself, but for your loved ones during these really troubling times. And make sure you also check out our community resiliency model that we're discussing as far as mental health. That's something you're also struggling with. So please keep in tune. We'll be sharing more in our social media, but thank you again, Dr. Tori. Thank you again for all your work in the front line, and we appreciate everything you've done.
Thank y'all very much.
Thank you, Dr. Tori.